Thank you for tuning in to our best practice series for medical providers working with refugee and immigrant youth and families. This is one video in a larger series hosted by the Trauma and Community Resilience Center at Boston Children's Hospital. Each short video will highlight experts in the fields of medicine and psychology who work with refugee and immigrant youth and families. We are grateful to SAMHSA and the National Child Traumatic Stress Network for their support in making this series happen. In this video, we will be hearing from Dr. Vanja Pejic. Dr. Vanja Pejic is an attending psychologist at Boston Children's Hospital and an instructor for Harvard Medical School. Dr. Pejic's research, practice, and teaching has focused on examining and reducing health inequities for marginalized children, youth, and families with a special focus in immigrant and refugee populations locally and internationally. Much of her research and clinical experience has examined development, implementation, and evaluation of culturally attuned prevention and intervention programs in school mental health. Dr. Pejic splits her time between two programs: Boston Children's Neighborhood Partnerships Program, in which she provides consultation, training, and clinical care at Boston International Newcomers Academy, a local high school for newly arrived immigrant and refugee youth, and at the Trauma and Community Resilience Center, where she serves as a consultant and researcher supporting development and delivery of trauma-informed systems and clinical interventions. Dr. Pejic serves as part-time faculty at Harvard School of Education, where she teaches on trauma-informed school practices and chairs a professional learning institute on mental health in schools, building systems of care. And now it is my pleasure to turn it over to Dr. Pejic.
Thank you so much, Sweet. And thank you for being with us today. The goal of this presentation, as Sweet has shared, is really to think about how we define trauma and what are the considerations for working with refugee and immigrant communities, including children and families. So to get us started, when we think about this topic, it's important to note that both refugee and immigrant children in the US experience higher rates of trauma and adversity than their non-immigrant peers. We know that approximately 80% of refugee immigrant children will experience some degree of violence in their life, either pre-migration, meaning in their life in their home country, during the migration journey, and or adversity that they experience once they arrive into new context. Even though this population experiences disproportionately higher levels of trauma than non-immigrant peers, many do not have long-term chronic psychiatric impairment. We also know that the critical piece to understanding the mental health of these communities is thinking about the sociocultural factors that can have a profound impact on their mental health. So when we think about sociocultural factors, we're thinking about supports around housing and transportation and education, and how are they resettling into their new community? What degree of social support and social networks do they have in their new community? And all of these psychosocial factors will either help reduce the potential mental health distress, including trauma symptoms, or if there's scarcity of resources and supports, if communities feel discriminated against and not supported, we can actually see those symptoms exacerbate, and we can see greater impact on mental health. Equally, we know that there's a great deal of limitation in terms of these communities accessing care. And even when they do access care, often the care is not culturally responsive and linguistically responsive to the needs of the community. We also know that there can be a great deal of mistrust in medical systems based on previous experience that they had in their home country or even once they've resettled. And we know that our own cultural backgrounds profoundly shape how we understand help seeking, how we understand healing, and so forth. But the key to really thinking about kind of mental health of refugee immigrant communities is attending to these different sociocultural factors. So by building trust with communities and understanding both their needs and strengths, but also attending to resettlement stressors that may get in the way of them accessing care, we actually can have an enormous impact on their long-term mental health outcomes, including trauma responses. So let's spend a little bit of time thinking about how we define trauma. So Trauma, really, or traumatic stress is any experience or situation that are emotionally or psychologically painful and distressing and that overwhelm one's ability to cope, leaving them powerless. We know that traumatic experiences are inherently complex, meaning that there is often a compounding nature, which we'll talk about in a second, of how that event impacts that child. So there's the child itself, but there's also the family, the community, the bigger social systems that are going to have a profound impact on ways in which that child heals from the event, or it can perpetuate further harm. We also know that trauma and post-trauma adversities strongly influence development, meaning that the age and stage in which child experiences a traumatic event can have a profound impact on later developmental stages and learning and social emotional support that that child may need. So a child that experienced an event at a 5 versus 7 at a 15 may show up with very different symptoms based on when that event occurred, right? Secondly, we know that there are lots of what we call post-trauma adversities that happen after a traumatic event. So there can be disruption in family systems. There can be lack of social support that child needs, or access to medical care that can be disrupted, or engagement with juvenile justice system or otherwise. So there's all of these additional adversities often happen once a traumatic event occurs, especially when we're thinking about a child from a refugee background. For example, if we think about while the child had to leave their home country, that in itself can be a traumatic event, right? Of suddenly having to leave because of war conflict. But then that child and their family goes through migration journey that further can escalate other traumatic responses as well. So that's what I mean by the compounding effect. And then lastly, what's really important to think about when we define trauma is that people will exhibit wide range of reactions to traumatic events. First, what one may define as traumatic versus somebody else may be different, but also the symptoms that we experience, how we think about those symptoms, how we label them will be different, again, based on age and stage, but also our cultural background, where we're from, how we understand healing, and so forth. So let's talk a little bit about how trauma in this community is further compounded by the experience of displacement. So first, when we think about trauma as a whole, we know that immigrant and refugee communities, as I said in the beginning, will experience disproportionate amounts of violence and abuse compared to non-immigrant peers. And again, that can be part of the community violence they're experiencing on a collective level or more individual experience that they have. We also know that immigrant refugee kids can often, through these traumatic events, feel a disconnection from themselves, from others, or their dignity. The key factor to thinking about trauma is that trauma leaves one powerless and feeling out of control, meaning then that event itself feels like I have no choice in decision making that I have in my life. So when we think about trauma, we're thinking both about the actual experience itself, but again, these post-secondary symptoms that can come from it as well. The second piece, when we think about trauma in relation to this community, is feelings of loss. Often, almost always, immigrant refugee kids will have to say goodbye to family members, to their land, to their culture. So there's losses, there's compounding losses that often individuals will experience. Loss of what you loved or what and now you're letting go of that. Loss of change, the sorrow of the world, the pain that you've seen in your community, whether again it's because of a war or conflict or whatever the reason may be you're leaving, and loss of what you expected your childhood to be, but what it is. And then there can also be ancestral grief, meaning intergenerational trauma potentially that has occurred in generations before you. So if we think about some immigrant refugee communities, conflict and violence has existed from one generation to the next, meaning that there can be ancestral grief that's carried on from one generation to the next. The third component that's really important to think about is cultural adjustment and bereavement. So for kids, like I said, there's loss of letting go of certain aspects of your cultural language, but there is also adjustment to a new culture, adaptation to a new place, new language, new way of being, new beliefs. And that requires time and really kind of negotiating and brokering with which aspects of the culture you want to keep and which aspects of the culture you want to let go from your home country, but also from the new context that you're in. There can also be, when we think about cultural adjustment bereavement, challenges around caregiver stress, right? And challenges of being in a new place and figuring out, again, what do we hold on to as a family and what we let go. And then the fourth kind of compounding effect when we think about trauma and displacement is resettlement stress, which is what I talked about earlier. We talked about psychosocial factors. So thinking about attending to basic needs like housing, access to adequate health care, nutrition, transportation, but also legal status, navigating a new community that you've never been part of. And even, child's educational history. Do they have educational gaps? How's that going to show up in school? Their ability to engage in curriculum and so forth. So you can see for kids of immigrant refugee background, when we think about trauma, we're not just talking about a single event that may have occurred in their home country, for example. We're talking about how that event, then there's compounding factors, compounding stressors that can then over time exacerbate those symptoms of trauma that you may see once the child shows up in your clinic. So what are some signs and symptoms of trauma that we may see in refugee children? Often when we think about traumatic stress, we think about these kind of 5 core areas where we can see trauma impact kids. The first place that we often see impact is safety and regulation, meaning that kids may be, in a constant kind of fight, flight, or freeze response where their stress response is overactivated, right? Because if you have been in a space where you're constantly responding to different stressors, if you grew up in a place where there's ongoing war and there's constant fear of danger, then that fight, flight, or freeze can be overactivated at times. So we can see challenges with kids being able to regulate their emotions throughout the day. We can also see regression in behavior. So skills that they once knew, now they have a hard time doing. Bedwetting can be one, right, where we see increase or changes in behavior or cognitive skills or things that they once knew. So there's lots of different ways that we can see safety, both physical safety impacted, but also psychological safety. Do I feel safe in this place, in this time? We can also see impact on their emotional expression. So thinking about, we can see these in kind of 2 extremes sometimes. We can see overwhelming or strong emotions that a child may exhibit, or we can see on the opposite end, numbing, right? So more of that, what we call a freeze response, where you're not quite sure what the child may be identifying. A child may have a hard time identifying emotional experiences, or even be able to give you helpful strategies of what's good for them. And this can be part of a trauma response, but this can also be just part of what we were talking about earlier about culture of not being exposed to emotional vocabulary language to be able to tell you how they feel. So because they may lack that language, emotional vocabulary language, their way of showing emotional distress may be through psychosomatic symptoms. So headaches, stomach aches, body aches, sleep disturbances, right, can all show up for kids during this time. We can also see impact relationally. So if you've experienced really difficult things over time, you may believe that the world is an unsafe place. So difficulty engaging with peers at school, difficulty engaging with adults, difficulty developing relationships, but also sustaining relationships out of fear, that this person may harm me. For kids who experience, for kids of refugee immigrant background, they also can have a fear of certain communities. So if they come from a community where police brutality was a factor, then they may be afraid of certain individuals when they come to the United States because of what they've experienced in their home country. We can also see impact on their cognition and learning. So we can see impact on both expressive and receptive language, ability to understand and receive and understand information, but also be able to respond. We can see enormous impact on their executive functioning. So ability to, hold information, understand information, give information back, their impulse control. So all of these factors can be greatly impacted. And then last but not least, we can see impact on how they understand themselves and the world around them. So kids can have a tendency to feel a sense of shame or guilt or self-blame. We often see that this sometimes with kids with immigrant refugee background when they say, why me? Why was I the chosen one to come here and other family members didn't? Or when if they lose somebody on their journey, feeling like it's my fault, right? So taking traumatic events and internalizing it as they had a control to change the outcome in some ways. And we can see impact on loss of their kind of future orientation and sense of agency. So thinking about, if you believe the world's an unsafe place, then it's hard to then imagine a difficult outcome for your future. So what hope do I have? Where do I go from here? We tend to especially see this for kids who may have a mixed status in the US where they can feel like I don't have the rights protections to kind of get me to the next phase of my goals. So you can see that trauma can really show up in many, many different ways. And again, all of these symptoms and presentations will be different based on age and stage, but also cultural background and beliefs that child and that family has. So what are some things that you as a medical provider can do to support kids who have experienced trauma and that are refugee immigrant background? Well, there's 5 kind of core areas that I'll walk us through. First and foremost, as we said in the previous slide, we know that both psychological and physical safety is a critical component of trauma response. So of course, then the first thing, one of the most important things that we can do as providers is try to create safe and predictable environments as much as we can in our clinic, but also beyond working, with outside providers to support kids even within their home context. So using a calm tone to explain what to expect, right? Meeting a child at their age and stage in terms of how we communicate, maintaining privacy, talking about confidentiality is really important. And thinking about kind of age and stage again for them and how you navigate that, and minimizing any kind of overwhelming stimuli, right? If somebody else is going to come in the room in the clinic, explaining who they are, if you're having a procedure, explaining every step of what's about to happen, because again, we are not sure what experiences they had with medical providers before. So the more that we can be transparent, the more we can prepare for kids of what's coming, how things are going to go. It can be really, really helpful. And then always asking for permission before exams or procedures, because again, a child may have experienced trauma, and ensuring that we are not in any ways re-traumatizing a child based on the procedure we're doing or safe touch or whatever the case may be. The second piece that we think about is using trauma-informed communication. So making sure as much as we can to ask open-ended questions. How does your body feel? I always appreciate asking kids, like, what has your experience in the past been of coming to the doctor? What do you think the role of the doctor is? What has been helpful for you when you come to a doctor's office? Just for you getting a sense of what their experience has been, what's worked, what hasn't, what preconceived notions they have of providers in different cultural contexts. Medical providers and hospitals and clinics operate differently. So it's important for you to know kind of how they're coming in and what the experience has been for them without making any assumptions. And then also helping them, as we said in the previous slide, there may be stress responses or sometimes somatic symptoms that we're seeing in kids, normalizing their stress reactions, normalizing that, their body is just communicating what it needs from them, and that often our bodies are serving as a protective factor against really scary things that happen to us. So as much as we can providing psychoeducation to kids, it can be a really powerful way of kind of giving them the tools to understand what's happening to them so they feel more in control of those things. The third thing that's really important is to think about how we screen and refer kids for further services if needed. So really thinking through using culturally sensitive and linguistically responsive trauma-informed screening tools, and thinking about measures that are in their native language if appropriate, thinking about measures that have been used in their communities. So we're thinking about like what's appropriate to screen for if we're worried about post-traumatic stress disorder or anxiety or whatever the case may be. And then secondly, thinking about how we connect them to outside supports. Doing a warm handoff can be a really powerful way of ensuring that trust and connecting kids to what they need. Schools often tend to be a quote unquote safer place for kids because school is a natural place where they are every day. So if it is about connecting with the school social worker or if there's a social worker in your clinic, just doing as much work as you can to really connect them thoughtfully to the right provider who, best case scenario, shares their cultural background and has the linguistic capacity. And if not, then at least has worked with refugee immigrant communities before to really help support them if there's a need for more trauma-focused work for this child and family. The fourth piece that's really important to consider is supporting whole family well-being. As we said in the beginning, so much of the immigrant refugee experience is shared by the whole family around the kind of psychosocial stressors of resettlement. So it's really important that we take time when we meet with a child or a family in a clinic to ask about, assess those psychosocial stressors. How is the caregiver dealing with stress? How are they attending to basic needs? Do they have those things? Do they have food on the table? Do they have a place to sleep? Do they know how to access local services? And if your role is not appropriate for that, then is there somebody within your clinic that you can connect them with that can help with some of those case management pieces? Sometimes if we do this work well, right off the bat, this can open up doors for then broader conversations around maybe physical and mental health needs that they have. So really meeting the family where they are and where their needs are in the moment. As much as we can, sharing resources in their family's language. If we're giving them things and they can't understand them, the chances of them are using it will of course be slim. So really thinking about how we share resources that are in their native language. And then always, always, always attending to and acknowledging and validating family strengths and resilience. Refugee immigrant communities have, as we've talked today, been through so much in terms of stressors, and equally they are here. And every family will tell you that ultimately what they want is for their child and their family to be well and to do well. So thinking about how we align with that and how we validate all the great things that are doing for their family to do well and be well. And then lastly, thinking about how whenever we're engaging with refugee communities, how we promote strength, stability, and hope. So highlighting child's coping skills can be one way, thinking about what's working for them, what's been helpful. Often the traditional kind of Western practices of mindfulness or breathing may not be the initial approach that they go to for dealing with stress or trauma. So thinking about what is, engaging conversations about what are ways of healing in your own community that have been helpful, and really kind of meeting them halfway and attending to those coping skills. And then also, as much as we can, working with the child and the family to really reinforce kind of healthy routines that can also help with regulation and support. So sleep, movement, connecting to people, both within the home, in the community, and so forth. So all five of these can be really helpful in, again, building relationship and assessing what the child needs, but also connecting them to services when appropriate. Okay. Thank you so much for engaging in this conversation today, and for having me.
And thank you, Dr. Page, for sharing your expertise with us. And we thank you all for watching. If you are interested in learning more, please visit our YouTube channel for more video. The link is in the video description box below. Thank you all so much.